It's Tuesday, February 23. This is the news on a PBCJ. I'm Carol Francis. Minister of Health and Wellness, Dr. Christopher Tufton, briefed the nation on a range of COVID-19 issues on Tuesday.
In the last week, the country added some 2,818 new COVID-19 cases and saw hospitalizations move from 245 to 270 patients positive for COVID-19. And I just pause to say here, there's a direct relationship, and this is borne out by an assessment of the data, a direct relationship between the number of cases that are reported as positive cases and the number of hospitalizations, or the increase in hospitalization. One almost naturally follows the other. The present state of hospitalization has become for us alarmingly high, and it is something we have spoken about in the past, that if we get to a stage where we become overwhelmed, and that's when we see the real consequences of the COVID pandemic. We have currently some 13 of 22 hospitals across the island at the red alert phase, which means that they have a greater than 84% occupancy level for its isolation capacity. 9 of these hospitals are at 100% or greater capacity. The current hospital census shows that Cornwall Regional Hospital, Falmouth Hospital, Anata Bay, Port Maria, Mandeville Regional, Maypen, Kingston Public, Princess Margaret, and Spanish Town hospitals all exceed their capacity to house patients who require isolated care. And this, of course, has to be worrying, not just for public health, but for the entire country.
Those who are ill are required to stay approximately 14 days in hospital. In a bid to respond to the need for hospital beds, the ministry is increasing the bed count in public hospitals with the use of field hospitals.
In addition to those, totaling some 72 beds, we're adding an additional 20 beds at the National Chest Hospital. And I visited the National Chest Hospital yesterday. Their COVID ward was 100% taken up, 36 beds. They are now adding additional 20 beds, and we're providing for them some additional infrastructure to support that. As well as at the University Hospital of the West Indies, where I again visited yesterday, they are converting an existing ward for general usage, which contains some 25 beds, to being an additional COVID ward. So UWI, which was again at capacity with 41 beds, are adding an additional 25 beds in order to accommodate the increases in the numbers, or the expected increases in numbers.
Jamaica is currently experiencing a nursing shortage due to increased overseas recruiting of nurses.
Each regional health authority has been instructed to hire additional staff based on their needs assessment.
Dr. Tufton stressed the need for COVID-19 measures to become a matter of personal responsibility.
I want to again underscore the importance of members of the public adhering to the COVID-19 protocols that have been put in place to reduce the spread of this virus. Citizens, I repeat, must play their part. We have to take a whole of society approach. The truth is, without compliance with the DRMA regulations, we risk undermining the efforts of the government, and indeed the government of the efforts of the people who comply, because one action affects all of us.
A field hospital in Falmouth, Trelawney, is expected to be handed over by the end of the week to the Western Regional Health Authority. The hospital will service the parishes of Hanover, Westmoreland, St. James and Trelawney. It has a 36-bed capacity and is being built to the tune of $36 million. The new field hospital is expected to alleviate some pressure from the Cornwall Regional Hospital, where the COVID-19 ward is at full patient capacity. The Noel Holmes Hospital in Hanover, designed to host 12 patients, has approximately 95% of capacity. The Yallahs High School in St. Thomas has closed its doors again for deep cleaning after staff and students reportedly tested positive for COVID-19. We get more in this report from Melvin Pennant.
The Yallahs High School in St. Thomas closed its doors on Monday. When our news team visited the school, this is what we saw. Sanitization teams hard at work. Principal Mark Malabver explains.
As of this morning, we have been advised that we now have 5 cases of personnel within the school contracting the coronavirus. That includes students and staff members.
He also explained how long the school will be closed for.
For a few days to allow for contact tracing, as well as to sanitize those areas that those students and staff members would have frequented. So it's on that basis that we have decided to close school and to implement all our protocols as it relates to persons contracting COVID-19 within the school.
This is the second time the school has had to close its doors since the start of the year. Yallahs High School is one of several schools within the parish that reopened physically to facilitate face-to-face classes for the new school term. Only students in upper school were required to be present. The lower school is still engaged in online learning platforms. Melvin Pennant, PBCJ News.
Agriculture is a significant driver of our economy and can significantly reduce the country's import bill. Jamaica's agriculture policy seeks to diversify the production of agricultural goods to build self-sufficiency, promote exports, and service the growing tourism industry. This led to a growth in production in a range of produce, including tomatoes. The price of tomatoes has plummeted in recent weeks due to a surplus. The Ministry of Agriculture and Fisheries has responded to the glut in tomatoes in St. Elizabeth by purchasing £10,000 from farmers under the government's buyback program. More from Marlon Samuels.
Tomatoes are sweet and juicy. They add color and flavor to any meal. They can be eaten by itself, used in appetizers, salads, stews, and a range of other dishes. Tomatoes enhances the flavor of each meal. They are loaded with vitamin A, C, and E. They contain flavonoids, potassium, and other minerals. Eating them regularly can reduce the risk of prostate cancer in men. The impact of COVID-19 on the tourism and other industries has resulted in market disruptions and associated costs for farmers who grow tomatoes. The end result is a glut in tomatoes. Some farmers are saying they are selling tomatoes for less than it costs to produce. The Ministry of Agriculture has responded to the glut in tomatoes in St. Elizabeth. Over $30 million was allocated to purchase 10,000 pounds of tomatoes from farmers. They will be resold in other parishes. The tomato glut has opened up opportunities for agricultural innovation through the Scientific Research Council, SRC. Part of the SRC's mandate is to support the growth and development of agriculture and agro-processing. Business owners can access the SRC's pilot processing plant to create tomato-based products such as sauces, pastes, or juices. Interested persons can contact the SRC at 876-927-1771-4. For the news on PBCJ, I am Marlon Samuels.
The country is closer to establishing the use of a central bank digital currency locally. That's the word from Bank of Jamaica Governor Richard Byles. Governor Byles gave the update at the BOJ's digital quarterly press briefing.
We have spent the last couple of months doing all the preliminary work of assessment and getting the protocol of approval through the government process, getting that right. So we are hopefully going to cabinet for approval very shortly, and we'll start a pilot in the second quarter or third quarter of this year. That pilot will run for a couple of months, hopefully conclude by about the end of the year, this year, and we'll be able to launch the public digital currency in early 2022.
CBDC is a form of central bank-backed currency and is therefore a legal tender. It is a fiat currency, which means it can be exchanged dollar for dollar with actual cash and is issued to licensed deposit-taking institutions on a wholesale basis. We go now to news straight from the business desk. Gabriel Thompson breaks down the government's proposed $830.8 billion budget for financial year 2021-2022.
The central government plans to spend a total of $830.8 billion Jamaican dollars for the financial year 2021-2022. $247.8 billion will go toward recurrent program expenditure. $239.2 billion has been set aside for the compensation of employees. $54.2 billion will go toward capital expenditure, while debt service and loans to public bodies will receive $272.2 billion and $17.3 billion respectively. These figures come amidst the announcement that as a result of the ongoing coronavirus pandemic, Jamaica's debt is now 110% of its gross domestic product, GDP. Minister of Finance and the Public Service, Dr. Nigel Clark, says the island has experienced the worst economic contraction in its history. Inclusive of the current January to March 2021 quarter, by the end of March, Jamaica will have experienced 5 consecutive quarters of economic decline, losing $73 billion in revenue. Speaking Thursday in the House of Representatives, Dr. Clark said the government intends to recover quickly.
And we aim for economic recovery to begin this upcoming fiscal year, and furthermore to begin this upcoming April to June quarter. Our priorities for recovery include: 1, we need to ensure that we make adequate provisions for vaccines. For economic recovery, it is essential that the financing exists for Jamaica to procure sufficient vaccines to reach herd immunity with respect to the coronavirus in the quickest possible time. We need to ensure that we bolster social support to assist the vulnerable persons and those who are most affected by the pandemic.
Highlighting the country's debt level, the finance minister cautioned that economic instability would greatly magnify existing challenges.
At a minimum, we have to ensure that we cover our interest costs, which constitute a major component of our non-discretionary expenditure, from our own revenue. This means, Madam Speaker, we have to reserve $125 billion of our revenue to pay interest. Not covering interest from revenue again this year would mean that we would need to borrow to pay our interest bill, which, given the elevated debt levels at 110% of GDP, which shot up by 15 points in one go from 94, it could quickly put us again on an unsustainable path, with adverse implications for jobs, for investment, for interest rates, inflation, and other economic variables, complicating recovery efforts. And, Madam Speaker, nobody wants that.
In the meantime, the government is seeking a 1-year delay to the anticipated implementation of public sector compensation due to the ongoing impacts of the coronavirus pandemic. Despite this, Dr. Clark says civil servants will receive a modest increase in wages.
We have undergone a thorough review and examination of public sector compensation, as we promised we would, and we have done it within the time frame that we promised we would, by December of 2020. But, Madam Speaker, given the massive impact of the pandemic, we do not have the resources to begin the implementation of the review and finance our recovery at the same time. Furthermore, it is critical, Madam Speaker, that whatever resources we can corral, we use this year on vaccines, the distribution of vaccines, and our social and economic recovery, inclusive of jobs and social support for those who have been hardest hit. After factoring annual increments, which are a part of the cost of public sector compensation, a very, very modest increase in wages has therefore been programmed for 21-22, with the expectation that the compensation structure will commence in financial year 2022-23. So we're not coming and asking for a freeze. In addition to the increment, there'll be we are proposing a very, very modest increase that can be afforded within the context.
In Monday's trading session, the JSE combined index advanced by 1,040 points to close at under 400,000 units. Overall market activity resulted from trading in 91 stocks, of which 34 advanced, 43 declined, and 14 traded firm. The junior market index declined by 27 points to close at under 3,000 units. Stocks advanced for Blue Power Group, CAC 2000 Limited, and Cargo Handlers Limited. Stocks declined for 138 Students Living Jamaica, AMG Packaging and Paper Company, and Barita Investments Limited. Trading firm were 138 Student Living Variable Preference, 1834 Investments Limited, and CAC 2000 9.5% preference shares. Trans-Jamaican Highway Limited was the volume leader with 4.2 million units, followed by Wigton Wind Farm Limited ordinary shares with 2.6 million units, and Sagicor Select Funds Limited Financial with 2.2 million units. Now for the foreign exchange. The US dollar on Monday, February 22, ended trading at $152.14. The Canadian dollar sold for an average $121.22. The pound sterling traded for $213.09, and the euro ended trading at $187.68. Oil prices rose on Tuesday, underpinned by the likely easing of COVID-19 lockdowns around the world, positive economic forecasts, and lower output as U.S. supplies were slow to return after a deep freeze in Texas shut down crude production. Brent crude futures rose 36 cents to $65.60 a barrel. West Texas Intermediate crude futures gained 39 cents to $62.09 a barrel. And that does it for the Tuesday edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
In regional news, we begin in St. Kitts and Nevis. Prime Minister Dr. Timothy Harris used his time in Parliament to urge citizens to take the COVID-19 vaccine. More from SKN Newsline.
Sections of the community expressed concern over taking COVID-19 vaccines. Prime Minister Dr. Timothy Harris pleaded in Parliament for citizens to protect their lives by taking the vaccines. Speaking in the February 2021 sitting of the National Assembly of St. Kitts and Nevis, Prime Minister Harris said the vaccines were safe and were important in achieving herd immunity in the Federation. He said the Ministry of Health is working towards vaccinating at least 70% of the population over the coming months as the Oxford AstraZeneca and other vaccines become available in the Federation.
Everyone should note that the primary objective of the vaccines is to prevent serious illness, which may also lead to death. There is no better reason to accept the vaccine than that of saving your life and that of your loved ones. The vaccines are safe, with no significant side effects so far, and they have undergone significant testing to ensure their efficacy and safety. Higher rates of vaccination will eventually reduce the rate of infection, illness, and deaths, but also it will reduce the possibility of new variants, since more infections equal a higher chance of mutation to new and possible dangerous variants.
Rollout of the COVID-19 vaccine in St. Kitts and Nevis began on 22nd February, with frontline workers taking their initial shot. Gov't, SKN Newsline.
In Trinidad and Tobago, some agents purporting to be working for vaccine companies have been attempting to take advantage of the country and sell overinflated and possibly fake vaccine. That's the word from Prime Minister Dr. Keith Rowley, who said the country has to be careful to buy only from authorized dealers. But he admits that small countries such as those in the Caribbean have been finding it difficult to engage in talks with suppliers to purchase these vaccines. Sunil Lala reports.
Will not talk to you unless you could buy 3 million doses. There is no way Trinidad and Tobago even needs 3 million doses, can store 3 million doses, or pay for 3 million doses.
Health Minister Terence Dialsing says this is the current situation being faced by many small states around the world. His comment came after Prime Minister Dr. Keith Rowley responded to statements by opposition MP Dr. Richard Secharan as to why other Caribbean countries are rolling out vaccines, while Trinidad and Tobago is yet to receive its first batch via the COVAX facility. Dr. Rowley explained that Barbados and Dominica made a request from India due to an overwhelming increase of COVID-19 cases. He admitted that it has been difficult to have bilateral talks with manufacturers of the vaccine.
It appears as though what is happening now is that if your order is a small order, you have no place in the line at this time.
Dr. Rowley noted that the vaccines through the COVAX facility range around US $5 and is less than $4 in India and Europe. But he says agents have been trying to take advantage of this country with prices upwards of $20 and $25 a dose.
I know of one instance where a local agent of one of the major manufacturers of this vaccine has advanced himself as an agent for the company and sought to get contracts here in Trinidad and Tobago to supply that vaccine. The local agent would have communicated with its foreign superior, only to be told, call the police.
Mr. Dialsing said these people have been reported to local agents of manufacturers who would treat with the matter. Dr. Rowley noted that he's also concerned about the COVAX facility due to vaccine inequity globally and said this is why CARICOM is attempting to get a second line of vaccines via the African Medical Council.
That the way it is going, the distribution of these vaccines and the behavior of some of the countries and those countries that are producing and using vaccines within their borders, that they are not acting in solidarity with the rest of the world nations.
Health Minister Dialsing said in the next few days, this country will know the expected arrival date of vaccines via the COVAX facility. Sonolala, TTT News.
A leading Caribbean epidemiologist does not believe COVID-19 vaccines should be mandatory, but instead has strongly encouraged everyone in the region to be immunized as early as possible. We hear more from Barbados today.
Chairman of PAHO's Regional Immunization Technical Advisory Group, Professor Peter Figueroa, made the comments during a virtual forum hosted by the University of the West Indies COVID-19 Task Force. Several Caribbean countries, including Barbados, have begun the rollout of their vaccination programs with the Oxford AstraZeneca vaccine. But Professor Figueroa, a former chief medical officer and chief epidemiologist in Jamaica, said people should be allowed to take the vaccine when they are comfortable.
No, I don't see the need for mandatory vaccination here at all. It is a new vaccine. We understand that some people are going to be concerned. You know, some people are always willing, they assess the evidence, and they're willing to go forward. I'm hoping that the majority of health workers fall into that group. In fact, we had a panel in Jamaica yesterday, and we did a quick poll, and 84% of the health workers were willing to take the vaccine now. So once the health workers go forward, set the example, we saw the Vice Chancellor going forward, we saw the principal at Cave Hill going forward. Let those who are comfortable going forward first take the vaccine. As people hear their friends, people they know, they see them get the vaccine, they see that everything is fine, they will start coming forward as well. I think we will be okay. There's no need to mandate this vaccine, in my view.
Professor Figueroa said he would also advise Rastafarians to take the vaccine, but acknowledged that living a healthy lifestyle would help in the fight against the virus.
We know that the Rastas prefer to go ital or natural. So this is important. I think the first part of your question was about how you build up your immune system. And I think that if you eat right, you exercise, you avoid excess alcohol or drugs, the substance abuse, if you avoid that, then your immune system under normal circumstances is going to be fine. Once you're eating right and you're living right. So now the idea of natural, when you eat foods, you get a whole variety of chemicals, proteins, you get vitamins, etc. The vaccine, you could say, is just a synthesized food that helps your body's immunity protect yourself against a specific disease.
In sports, we go trackside with athletics. Jamaicans claimed 6 medals at the National Junior College Athletics Association NJCAA Region 6 Indoor Championships, which ended at Pittsburgh State University in Concordia, Kansas on Sunday. Former Jamaican junior Anya Ashley of Barton County Community College successfully defended her triple and high jump titles. Courtney Lawrence set a meet record in the men's shot put. Daniel Cope of Cloud County set a new personal best, 19.35 meters, to win the men's weight throw. NJCAA event leaders Tyrese Reed and Kean Green of Barton won the men's and women's 800 titles respectively. Andrew Betton of Cloud County retained his heptathlon title. And that's all we have for you today. Join us again tomorrow at the same time, same place for more news and sports right here on PBCJ, the People's Station.